And it's so easy for anyone to get caught up. And that's a part of the psychological game of racism, right? We will make this the standard of beauty. We will make this the model of achieving the dream, so that you want that so bad you go beyond what you know is good and right about you and your community to try to achieve something that was never meant to be about you. But it's like Dr. Barnett said, it's baked into everything, right? Legislation, right? So we have laws and codes on the book that support racism. And then we have the educational institution that is built to support a one-sided view of history, a one-sided way of doing things. And then we have medicine, right? One of the most ones that perpetuate racism, just looking at healthcare disparities. And so I mean, even if you don't know the exact history or the year or who did what, you can just look at today's media as to what's causing the biggest backlash. Fights against voter rights, fights against talking about critical race theory, fights about the disproportionate number of Blacks dying from COVID as compared to whites, right? So if you just look at what the stronghold is about, we don't want this taught in our schools, and we need to change these voting laws. There's a reason behind all of that fight and that push, because the truth is racism is baked deep well into it. And so this fight to preserve things, to continue on with this good old boy system, is the reason why you see that pushback. It's definitely baked into all institutions.
I want to take it just one step further. We think about healthcare disparities just kind of starting now with healthcare and the social determinants of health, but if you really think about it, it really is the political determinants of health that are the basis for these social determinants. Back in the 1600s, there were actual, true, and lawful policies that said that Black and Indigenous people could not grow their own food, they could not own their own land, they could not go outside of a 1 mile radius without getting a permission slip, and so kept them in a certain area.
Black codes.
They could not learn a trade, and they could not read and write. And so all the things that would advance them, healthcare, food. I mean, it's simple. You think about food deserts now. Well, think about then when you can't buy, and then you have to buy from somebody else, right? And so those policies were real policies, and it was lawful. And there are still lawful things that it was okay then, and the things that exist now are okay now. And these are the things that we have to fight about. But they really do have their roots in managing policy. That is what really determines what the social determinants then end up being. And it affects healthcare, but it really affects everything.